Welcome to the Dr. Mudgil podcast. This is episode 176. We are in April. It's actually a little rainy but warm today. We actually had an amazing 80 degree day. Last weekend, spring is just here. I mean, it's, April showers, they say. So I'm excited for some flowers to be blooming. I love this time of year. I love spring. I love summer. I love fall too. I just don't love winter, as I've said many times over, but spring is in the air and I'm loving it. So in this week's podcast, I'm actually going to kind of pick up a little bit on what we've been discussing in my last podcast. I mean, not quite that, but something sort of similar-ish. And I'm actually going to talk about a patient that I saw this week and just like a conversation that we had, which got me thinking that, I've done podcasts before about like deductibles and co-insurances and all that sort of stuff. But it's something that comes up time and time again, particularly as the years have gone on. When I started my practice back in 2009, I can tell you, no one really had a deductible. I mean, it was so rare unless you had some really shit plan. But now, every single plan, doesn't matter how Cadillac your plan is, almost everyone, I would say everyone, has some sort of deductible. I have a deductible on my plan, even though I pay a fortune for my family's health insurance a year. And more or less, all of my patients have some sort of deductible. So particularly until someone meets their deductible, it's always a frequent part of the conversation. Well, how much does this cost? How much is this going to be? How much is that going to be? Et cetera, et cetera. The problem really is, for us on the doctor end of things, is I actually have no idea, because if you have United Healthcare, they're 30 different United Healthcares, and then each one of them have their own negotiated rate with the hospital that I'm affiliated with, which is Mount Sinai Hospital in New York City. And it's literally impossible for me to tell my patients what the charge is for a particular code, because, I'm a smart guy and I have great memory, but I can't memorize a million different codes for a gajillion different insurances, what the Blue Cross Blue Shield code is for 88305 or blah, 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 blah. I mean, there's millions of codes and millions of different reimbursements. So it's actually an impossible task. So typically what we tell our patients is, if we're doing a bigger procedure, hey, these are the codes, call our insurance company. If you have a deductible, they'll tell you how much it's going to cost. But the problem is in dermatology is a lot of things happen on the fly. A patient comes in, you're doing a skin check. They have 3 things that could be a skin cancer, which you need to biopsy. And, the patient is there. You want to, if you're worried they have a skin cancer, you want to biopsy it there, then in there, so that you could get them treated and cured for skin cancer. So there's really no time to say, okay, well, you're going to need 3 biopsies. So let's call your insurance company, then have you come back a week later. And it's just not a practical way to practice medicine. It's not practical for the patients, for sure. My patients are in New York City. They're hustling and bustling. They're busy. They want to get stuff done when they're at the doctor's office, understandably. And I'm their doctor, and I want to get stuff done for them. I have millions of patients that I need to see as well. So I want to take care of my patients in the most efficient way possible. But frequently what happens is, because everyone has a deductible, and then by the time the insurance company processes it, because, we'll send our claim in, and then they'll say, oh, you got to send the notes in, yada, yada, yada. So frequently when a patient, finally gets an EOB, it's many months after their visit, and the details of the visit are hazy, and, they're not quite sure exactly what went down in the room, because, honestly, who can remember exactly what happened in your doctor's office 3 months ago, especially when you have a million other things going on in your life. So I figured I would use this conversation I had with my patient this week to sort of explain to you what happens, because, here's what happened. So my patient came in. This has been my patient for 16 years, I guess, since I started my practice. I used to see him in my New York City office. Then he got married, so I would see him and his wife. Then they have, I think he has 2 daughters now, but they moved out to Long Island, so I see him in my Long Island office. And his wife was seen in my office back in early February. She was seen by my PA Nick here, and I guess they have a deductible, obviously, and I guess whatever Nick did, it went towards the deductible because they haven't met their deductible yet. So I was examining him. He just came in for a skin check, some other stuff that we took care of. And then at the end of the visit, he's like, hey, can I ask you something? And I saw the bill sitting on top of the counter, so I kind of knew what was coming. And he said, yeah. I was like, yeah, of course, ask me whatever you want to ask. He's like, well, my wife was seen 6 weeks ago or whatever it was. And, we got a charge for $400 and something for the visit. And I just wanted to go over it with you, because Like my wife said, like Nick was only in the room for like 5 minutes, and how could it have cost that much, et cetera, et cetera. So I said, okay. I was like, let me see the bill. So he gave me the bill. I have a copy of it. This is not what he showed me, but I was looking through it. So it looks like this is someone who has a history of this person, like this individual's wife, someone who has a history of skin cancer and came in for a full skin check. In addition to that, she had some kind of scar that was injected with some steroids. She had some stuff that needed to be frozen, and she had a skin biopsy. So just based on like what I'm seeing here alone, there's no way that could have taken 5 minutes. I mean, Nick is very efficient and he's amazing, but no way anyone can accomplish all that, in 5 minutes. So right then and there, I was like, listen, man, it's like maybe the memory of the visit is a little bit hazy, but it's actually quite impossible that all of that happened in 5 minutes. Not only that, it's not only the time in the exam room when you see a patient, because after, you see the patient, you do everything you have to do, but that needs to get documented somehow. So like all of those things that happen in the room need to get into like a note, right? So Nick has to document the note, all the findings on the note, the spots that he saw, or things that might have been suspicious or benign or whatever the case may be. He has to document whatever procedures he did. So if he's injected something, he's got to say, okay, I injected like this many, milligrams per cc of cortisone into like this spot, and like label it on the chart. He did a skin biopsy, so he's got to like write a whole note about that. We used this anesthesia, we did this biopsy at this site. Then he's got to log that biopsy into a biopsy log. He's got to create a requisition form that goes to the pathology lab. He needs to package all that up, make sure all the I's are dotted and T's are crossed. So that takes time. So, that probably takes like half an hour to get everything that needs to be done for the note. So anyways, that's that. As you've heard me say many times over, the most important part of any anti-aging skin regimen is using a proper sunscreen, namely one that's at least an SPF 30 and contains titanium or zinc or both. I couldn't be more excited to announce the launch of these two amazing Dr. Mudgil brand sunscreens. One is tinted, one is non-tinted, depending on what your preference is. I also have an amazing hydrating and moisturizing serum, which your skin is absolutely going to love. There's a link in the description below, which you can click to check out the products. You are going to love them as much as I do. Then we talked about the biopsy, and he's like, well, no one ever told us like the results of the biopsy. I mean, and I was like, well, that's actually impossible because I'm so OCD that everything is very, very meticulously documented in my office. And my assistant was in the room, and I said, hey, her name is Nina. I said, hey, Nina, can you pull up, Clara is the name of this HIPAA compliant messaging platform that we use for our patients. And we can send messages to our patients, and we also tell if the messages have been read, et cetera. So I said, can you pull up so-and-so's Clara, and let's just see if it's in there, because I would find it very unusual that, we did not report pathology results, because we always do. Good news, bad news, 100% of the time we report the results to our patients. And we always tell them that, listen, we're going to call you in a couple of days, good news or bad news, we're going to let you know what the biopsy showed. So we go into Clara, and of course, there's a note that says, hey, so-and-so, good news, your biopsy came back benign, nothing more needs to be done, et cetera. And then on the bottom of that, it said read by patient. I said, hey, look right here. It looks like your wife actually did get her pathology results. And moreover, it looks like she actually read this message that we sent. And it was a very amicable conversation. The guy ends up, he's actually like a health insurance salesman, so he obviously like gets it. And then I was like explaining to him like, exactly what goes on. So the visit, all of the charges for like the full skin check, getting a bunch of spots like treated with liquid nitrogen, which were, I didn't actually like look through the note, or I did at the time, but I can't remember exactly what was frozen, but a whole bunch of things were frozen. There was a skin biopsy that was done. And then included in that charge of whatever it was, $400 something, was the actual pathology as well, like the reading of the pathology results, because, I'm the pathologist. So I explained to the patient that, listen, in order for that to all happen, so, your wife has to call the office to make an appointment. So I need staff that's going to receive that phone call, make the appointment, and all that sort of stuff. So there's overhead that goes into that. Then guess what? My EMR is not free. We need to make that appointment in some kind of software that I pay an exorbitant monthly fee for. And then we also have to pay for this HIPAA compliant messaging platform that I have, which is another like $500 a month, which we will send our forms and communicate with our patient just so everything's done before they're seen in the office. Then when your wife came to the office, I have to have, she saw Nick, and I have to have a medical assistant assisting Nick. She had a bunch of spots that were frozen. Someone needs to pay for the liquid nitrogen, so that someone is me. And the liquid nitrogen is stored in a many $1,000 canister and is used as a like a $500 or $800 device that we use to spray the liquid nitrogen that holds it safely, etc. And then there's a biopsy that was performed. So someone needs to buy those instruments. Those instruments need to be sterilized in a sterilizer. We have to administer anesthesia, which costs money. And then we have to obviously dress the wound with Band-Aids, etc. All gauze, all the materials that are used for the biopsy. And then guess what? That biopsy has to be put in a jar of formalin, which I pay for because I'm the pathology lab. We have to process that specimen. So I have a pathology lab, so then I have to pay a lab tech to come in who processes my specimens overnight. And there's all of the hundreds of thousands of dollars worth of equipment that I have that processes the specimen. And then I have to read the report, I have to issue the report, all that sort of stuff. And then, it all comes full circle. We tell you what the results are, and all of that. There's a lot of overhead that goes into that. And, I'm probably doing it, honestly, with this particular insurance company, possibly at a loss. So for me, whatever that charge was, it sounded like a bargain, a value. And, in days past, no one would even think about these things because, you didn't the insurance company would just, we'd submit the charges. And of course, the insurance companies pay us an abysmally low amount. As of, for instance, my reimbursements from Aetna insurance are 40% of what they were in 2009 for some codes. Meanwhile, my overhead is hundreds and hundreds of 500% more than it was in 2009. But Medicare reimbursements and Medicare reimbursements haven't increased in many years. And, they don't even keep up with inflation, to be honest with you. And private health insurers use Medicare as their guideline for what they're going to reimburse. And in the New York area, most private insurers reimburse a percentage of what the Medicare reimbursement is. So if Medicare reimburses X amount, United Healthcare might reimburse 60% of that amount. I mean, it's a complete utter racket. But the point is, all of us are seeing out-of-pocket charges. And the reason why that is because our government, and this all really amplified with Obamacare, with the Affordable Care Act, and which I talked about in my last podcast, the vertical integration of medicine and the consolidation of healthcare. It really empowered private health insurers, sprawling hospital systems. Private equity got very involved with medicine, before that, but really amplified around that time. And then pharmacy benefit managers have consolidated the pharmacy side of things, and that's the way for private health insurers to recoup profits from other buckets that they might be losing with the actual patient care. But one of the things that really happened is deductibles went haywire, and now the way insurance companies make a huge amount of profit is we all pay our premiums, but we all have a deductible that needs to be hit before the insurance company starts paying for the services that are rendered by your doctor. So the doctor is made to be the bad guy because the insurance company doesn't bill the patient and tell them what to pay the doctor. It's on the doctor. So there's billing overhead too. I have to have a billing company, and we have to send out statements, and all that costs money, and all that costs money that comes out of the doctor's side of, of the equation here. And insurance companies, it's brilliant what they did. It's actually diabolical what they did, because basically what it does is it positions patient against doctor and doctor against patient. Now I've seen the patient, I've administered care, they're done. This individual's wife was well taken care of. And now 6 weeks later, the bill arrives, but the care has already been rendered. Like I said, that's go to a restaurant. And, first, this individual paid, but, he obviously had questions, which I was happy to answer, of course. But for many of my patients, they don't. And, we have to chase them, and then we have to send them to collections, and have to hire a law company that deals with collections, who, if we ever get paid, they keep whatever 30 or 40% or whatever is recouped. It's a complete, utter racket. But the insurance companies don't care. This is really the kind of chaos that they love, because what it does is it makes the doctor the adversary of the patient. So even though we cared for the patient, we did everything we could to help our patient, the onus is on us to bill them after we've seen them. And of course, no one wants to get a bill, but it's really the insurance companies are the ones who are creating this bill. So what should really happen is the insurance company should bill the patient, and then the insurance company should pay the doctor. Instead, they take themselves out of the equation. They take the administrative burden of doing that out of the equation, and they stick it on the doctor's shoulders, and it's complete bullshit. And the reason why I talk about this so much is because I feel like everyone needs to talk about this a lot more. The more that, doctors are kind of open about, how things work on our end of things, so patients can understand that, oh, wow, my doctor isn't a bad person. Like, this is crazy what the private health insurance companies are doing, because it is, in fact, crazy. As I've said countless times, doctors and patients are on one side of the fence. Patients come to the doctor because they need help. Doctors literally give up a decade plus many more years to learn how to become a doctor, because it's a passion. You have to learn the skill to be able to take care of your patients. On the other side of the fence are private health insurance companies, sprawling hospital systems, private equity, and pharmacy benefit management companies, which are basically just trying to F over patients and their doctors in any and every way possible to maximize their profit margin. And unless we speak up, patients and doctors, unless we're vocal about all of this crazy, how unjust and evil this system is, things are never going to change. So with that, I hope you all have a wonderful, restful weekend and are just ready to crush the week ahead. Let's get it. How was that?